Molly, do you want to talk a little bit about kind of the other relevant piece of the act?
Sure, yeah. So I would say that one of the primary ways, obviously, that the CARES Act supports our health system is through the $100 billion fund, which they're going to run through the Public Health and Social Services Emergency Fund. So essentially, it's to cover non-reimbursable expenses that are attributable to COVID-19. And so all healthcare entities or any healthcare entity that provides healthcare diagnoses or testing essentially are eligible for the fund. So they have to be healthcare providers under the Social Security Act. But some of the process and criteria for those providers, since it's designed to be immediately responsive to needs, like HHS has been instructed to review applications and make payments on a rolling basis in order to get the money into the health system as quickly as possible. We are currently waiting on the HHS guidelines for that application. Every single senator and representative on the Hill has been constantly pressuring HHS for the last, I guess it's 10 days ever since the bill passed, to get those guidelines out as quickly as possible. I think that they're struggling with some of the payment formulas, but the hope is that we should see something by the end of the week, this week, and so that people will then have a better direction as to how they can apply for this funding. But through the statute, HHS has been given significant flexibility in determining how the funds would be allocated. So we should see that in the guidance. So essentially what we're looking at is, potential expenses that could qualify. It's basically all non-reimbursable expenses that could be attributed to COVID-19. So examples, I guess, would include like building or retrofitting of new ICUs for hospitals, or increased staffing or training. Personal protective equipment is obviously a big one. The building of temporary structures. There's also room for foregone revenue from canceled procedures. There's been a lot of discussion about how HHS will kind of prioritize that. The view is that maybe that would be less of a priority than obviously increased staffing or personal protective equipment. But the good thing is that they have in statute that they will consider foregone expenses from canceled procedures, because I know that that's a huge thing for a lot of systems and smaller outpatient facilities. But I would say besides the PHSSEF, the other major portion of the bill is a lot of relief that they're offering under Medicare. So individual providers can go to their local MACs and request 6-month payment advancement for what they see as perceived Medicare payments for the future coming down the line. Obviously, a lot of the patients initially, and still as the trend is going now, that we're seeing who are being taken care of with COVID-19 are in the age demographic who are Medicare and Medicaid patients. So HHS is trying to get that money out the door. They said just earlier today that they are like earmarking $30 billion from the appropriation to try and get those advanced Medicare payments out the door, because a lot of hospitals and providers have already applied to their local MACs to see if they can get those advanced payments. There's also they eliminated the 2% increase for the Medicare sequester, and CMS actually just put out a rule on Friday discussing a reduction in the payment for Medicare Advantage plans as well. So HHS, and that's even outside of the CARES Act. So HHS is kind of frantically doing everything they can right now to reduce the payment burden on the healthcare system as a whole.